As we kick off 2018, medicine is facing a shift like we've never seen before as information and technology are advancing at a pace faster than even we can keep up with. Crowded clinics and hospital waiting rooms are now giving way to an app culture, which makes it possible to request a healthcare provider to visit you at home. Wearable fitness trackers are sharing the stage with health monitors, and soon, wearable drug dispensers, while telemedicine makes it possible to provide clinical health care and education from a distance. Tri-County Heart Institute is adding telemedicine to their list of patient services. Cardiologist Dr. Nitza Alvarez explains how their new healow app with Televisit for smartphones and tablets is providing patients with more staff accessibility, faster response, and flexibility for patients with busy, active lifestyles.
Telemedicine is the ability to be able to access healthcare without having to be there physically using the technology that we have these days. We cannot do this through Skype. This cannot be done through a regular internet access. The system that we use is a secure system. We do this through the electronic medical record, and these are HIPAA compliant, and the portals are very secure. The benefit is actually the majority for the patient. They have easier access to the providers, and we can help more patients. You don't have to rely on a schedule and office hours. You can make yourself available for those patients that might need you in a different time that your office schedule allows for them. If you know how to manage a computer, there's nothing to be afraid of. You just need a computer, access to the internet, and the rest is just as smooth as going in to check your email. It's that simple. This is nothing to substitute that interaction with your physician. It's going to make it more accessible for you. This is going to be like a phone call, but in this case it's better than a phone call because you can see the face of your doctor, you can interact. We can also track your physical activity and what is happening with you. You know, we know that the technology is there. It's just a matter of connecting through the portal, and we'll be able to see, you know, how many steps a day are you walking, what is happening with your blood pressure. My first patient was actually discharged from the hospital with the diagnosis of congestive heart failure. It was very difficult to transfer from office to office, so I decided to kind of like launch the telemedicine, and so her daughter helped her set it up, and that way we can get easier access, see the patient, evaluate the patient within a few days after discharge. The second experience that we had was for a patient that moved from the area and wanted to continue receiving his care through me, so we actually set her up for a telemedicine conference, and we did an appointment through telemedicine. They've been very receptive and happy, and they also had that comfort that at least I will have access to my physician. It doesn't matter where I'm at. So I think that embracing the technology is going to be crucial for this, but definitely is a very positive thing in medicine for us these days.
Also, Dr. Alvarez would like to invite you to her free lecture as part of February's Heart Health Month and Go Red for Women, presented by Central Florida Health. Join her on February 13th at 9 a.m. at Harbor Hills Clubhouse. Enjoy brunch and a mini health fair where you can learn more about community cardiac care services, as well as meet with representatives of the American Heart Association.
This year we're going to be talking about trends in women care. I think it's going to be a very interesting talk. We're going to be talking about not only, you know, the common things that we know about cardiovascular risk factor for women, but what's new, what things to look for, and what else do we have to worry in general about women's health.
This event is free, but you must pre-register online. We'll have highlights in our March episode. You'll find information on Dr. Nitza Alvarez and the Tri-County Heart Institute when you click the digital medicine story link icon online at yourhometownhealth.com.